In approximately 1922, two individuals migrated to New York from Spain. My grandmother was born in 1931, following the births of her two brothers and one sister. She lived in Brooklyn and worked in the city of New York as she held positions like a reservation agent at the Taft Hotel and in a factory that made children's clothing, to name a couple. She met her husband, a farming boy from Oklahoma who had joined the Coast Guard and was stationed in New York City. They lived in Staten Island until they were transferred to Mobile, Alabama. In Mobile, she gave birth to a daughter who unfortunately suffered a crib death at just 2 months old. 1 year later, she had another daughter, and after 2 years in Mobile, Alabama, they were transferred to Cape May, New Jersey. From Cape May, New Jersey, they were sent to Guantanamo Bay, Cuba, where another daughter was born in 1955. My grandmother had a nice life being married to an officer and was able to stay at home for many years raising her two daughters and moving frequently as a serviceman's wife. Over the years, the family was fortunate to live in California, Virginia, Connecticut, Texas, Maryland, and even Puerto Rico for many years of her life. When her daughters were in school, she took jobs to keep her busy while her husband was sometimes out to sea on ships for very long periods of time. She worked at a library and also in a deli and also as a legal receptionist for many years. They decided to settle in Florida in 1973. Over the younger years, the family was very healthy for the most part, other than some severe back issues from a slipped disc in my grandmother's back, which resolved itself. For all of their 50 years together, they smoked cigarettes also. Unfortunately, her husband passed away at the age of 66 from prostate cancer. She decided to cease smoking at the age of 70. After her later years, she visited a emergency room for a severe sore throat, which were treated with antibiotics. From the antibiotics caused her to contract a severe case of C. diff. She was hospitalized for dehydration and had difficulty with recovery. She had several bouts with C. diff in 1 year due to antibiotics given to her for urinary tract infections. It was necessary for her to have several hospitalizations and physical therapy. She also lost an extreme amount of weight and was malnutritioned. Not long after, she returned home and then suffered a ischemic stroke, which required her to have a pacemaker installed at the age of 82. She also continued physical and occupational therapy following the placement of the pacemaker, which after several months of recovery has began to get better. She has experienced a decline in her mental capacity immediately following the stroke and has increasingly gotten worse over the years. She began to be more dependent as her daughters had started to care for them full time, which enables her to get to her doctor's appointments, physical therapy, the hair salon, the ability to get her meals, and daily medications. Her family helps her to be active and do social community activities such as going to the movies, the YMCA, and visiting extended family in various states. Over the years, her blood pressure has been under control with medication, and she also takes cholesterol medications and antidepressant medications. And also yearly, she has a injection for osteoporosis. To go over some medications that she is currently on, she's on atorvastatin, Prozac, aspirin, a daily aspirin, folic acid, vitamin D, and vitamin B12. She's also on levothyroxine, a daily iron and cranberry pills to prevent urinary tract infection, and probiotics for prophylaxis for C. diff. Over the years, she's had constant blood workups and realized that she enjoys cruising, eating spaghetti, and watching movies. And she also misses to be able to dance and be more independent. But as with physical and occupational therapy, uh, they're working with her to improve that. In the picture is a hat that her husband had, and it represents the U.S. Coast Guard and the time that they served and all the memories that were brought from that.